I'm basically an occupational therapist. So what major mediums we use in occupational therapy is for pediatrics, play, activities, and occupation. And even for the adults, we use the same kind of play in the initial to skill build, and then go on to fine tune the skill build through activities, and then come into actual occupational independence through giving the actual occupations for them. So water is one of the medium we use in the therapy aspects, and I'm a certified occupational therapist in Halavic technique, that is water specific therapy. The attitude or why it is difference as a medium in the therapy is um, the attitude of the therapist totally changes when it comes to handling in the water, and our typical therapist mentality should be left out in the floor itself and in the therapy hall itself when you come in, because the whole gravity, whole field of support for the client, and the way you handle and your point of control on the client, everything changes. So the mentality of the aquatic therapist is a little bit different when it comes to a land-based therapy. So the attitude has to change for both the mediums, because when you come out, you have to shift again to the regular medium therapy. And water gives me immense opportunity to innovate and invent myself into different sorts of games, and I can easily build a trust on clients, because there is very minimal damage or very minimal hurt I can bring upon the client, because they are very safe, not going to fall, and they are all the time in the safe zone. And you see Dr. Amit, who is the president of Indian Aquatic Therapy Network of India, who is working there in black t-shirt. I know everybody is in black there, with the one who is in the center. So what happens basically in aquatic therapy? The aquatic environment provides a unique medium where the education and the strengthening of the neuromuscular aspects can get better. The water buoyancy and the freedom as a therapist and as a client we get in the water is great. So we use that as a mode for bridging up whatever the skill we need to bridge. And increasing muscular strength occurs quickly, because there is always the resistance of the water around you, and you can use it along any movement you want to create. So there is this all the antagonist and agonist muscles all the time in support for us. So we won't be leaving out any muscle untouched in that process. So as a combination, we use this resistance and freedom to create a excellent therapeutic medium and bring out our creativity in coming out with the different sorts of exercises and movements, so that the confidence of the client goes up. How does it work? How exactly does it work when it comes to particular components there? And this is an image from the recently concluded NatCon, National Aquatic Therapy Conference we had in last April. When it comes to spasticity, the spasticity is a common issue when it comes to neurological conditions, sometimes the spinal cord injury also, depending on the level, yes. So when it comes to spasticity, a regular cold weather can play a exacerbated role. And so what we do is we have this therapeutic tools which are thermoregulated, temperature controlled. So soothing heat and soothing water temperature reduces the spasticity, frees the muscle in the movement. And there are evidence which states that the use of thermoregulated swimming pool in reducing spasticity is very good for the therapist purpose. And strengthening, obviously, yes, because of the buoyancy, because of the water touching you all the places, the resistance is provided in any movements you want to use. So you can use that resistance to build the muscle strengthening, and automatically what happens, like you can plan out or implement the movement patterns in any particular joint to build the strengthening. So any muscle which is, and this is also important to negotiate the tone difference and the muscle weakness difference, because sometimes when it comes to spasticity, what happens is there is an increased muscle tone in one group of muscles, and then the reduced muscle tone or the weakness in the other group of muscle, opposite group usually. This negotiation can happen if the therapist is using the clinical knowledge correctly. balance, yes, all the time there is continuous support and touching of the water on your body, so you will not be falling down. Even if you fall, there is enough time for you to balance yourself and stand. So the confidence of the client goes up when they are in a confident state, when they are balanced state. Obviously their movement improves, and their performance to move their distal part of the limbs will improve when the core and the base is obviously set in the right place. Aquatic therapy of the water is a very big and very important tool in our process, as we recently found out. Now what we are doing is, again, having said that, aquatic therapy is an adjunct for the main land-based therapy. So aquatic therapy is the skill builder, and obviously the actual occupational independence of the client has to be done in the land-based therapy. So you use aquatic therapy to bring out your skill building, then make the occupational activities in the land-based session. So use it as a bridging aspect. When it comes to particularly for this gait training, yes, in the swimming pool we use the muscle re-education strategies. We use reduction of spasticity and better movement to control and strengthening. All these things will combine together and play a support factor for us to in improving the gait, making the people walk with less fear of falling down, because therapists can give less support. In simple example, if I give you, if you walk in a shallow water, you will feel your dorsiflexors, that is your ankle dorsiflexion, works a lot because you're walking against the water and going resisting against the water. The same technique you can use it for any part of the muscle, knee extensors or even the hip extensors or hip flexors. This is the same concept we are using. When you have a stable base, when you have a core strengthening done, so automatically what happens is you're reaching out activities for the hand, which are very important for activities of daily living. As an occupational therapist, my focus will be on that. But again, for any rehabilitation field, the end goal is always to be putting them independent in their day-to-day life activities. So bridging this as a core stability process and experiencing them with their functional reach of the hand and shoulders will enhance the activities or enhance the function of the hand, which in turn will improve the activities of daily living and independence of that particular person. Resistance and toning, no need to tell you, the viscosity and the buoyancy will obviously help us to bridge the toning. And since the resistance is in all the places, obviously the co-contraction component comes into the picture, and this will help us improve the muscle tone. Some of the precautions we need to use is if the person is having pressure sores or any open wound, yes, obviously we need to be very clear about it, because either the person can get infected because of the water, or the water's ability to break down the skin or around the area of the open wound will cause difficulties. And in the injury levels of T6 and above, there is high risk of autonomic dysreflexia, where the patient might go into shock or hypertension or arrhythmia, or the temperatures might not be suitable for them. But the careful administration of this is very much needed. And most importantly, the certified, qualified aquatic therapist is definitely needed, so that they know what they are doing in that business. So the client gets the benefit out of it. As an advancement in any field now, instead of just doing exercises in the water, we have come up with lots of modifications and gradations. We started using treadmills, hoists and holsters for the clients, and the swimming noodles and water dumbbells, floats and steppers are there to use in multiple stages of spinal cord recovery, to make the people achieve more skill building in that process. You see Dr. Prashant, he's the first aquatic therapist in India. He's been the mentor for all of us there, teaching in the conference. This is very important, because aquatic therapy, when it comes, everybody think it's just
Sir,
working in the swimming
10
pool.
minutes are over.
There are techniques.
10
Yes,
minutes
sir.
are over. Yes, sir. Thank you.
Yeah. So there are very few techniques which we use, and these are all very important. Some of them are patented and copyrighted. So unless until you are licensed, you will not be able to use them. So I'm going to just name the techniques. There is Watsu technique. It's basically passively done to relax the muscles, relax the mental aspects. Badraga's ring method is basically playing with lots of synergy patterns, and Halovic method works on the neuromuscular concept. Aichi is basically Tai Chi in water, slow resisted movements for relaxation as well as movement control. Bodenko method is again used as a neuromuscular facilitation method. So these are some of the professional bodies in India and internationally. There is Aquatic Therapy Network of India, International Aquatic Therapy Federation (IATF), Watsu India, and WABA is the World Aquatic Bodywork Association. If anybody is willing to pursue this thing, get a certification or a course done by any of these organizations. So wherever it is done, as Dr. Deepa mentioned in the beginning, the evidence is the key factor in the rehabilitation field. So these are some of the evidences which suggest aquatic therapy helps in spinal cord injury directly.